The system was never meant and designed for me to exist today. The system was never meant for me to be where I am, a leader in health, a leader in equity, a leader
I
who's
agree.
all these things. But here's who I do trust.
Okay.
I do trust the individuals who are in the system, but not of the system.
Welcome back once again. This one is the most exciting interview I've ever done. This is the Dr. Michael Forde. And I want to say, first off, welcome to the Healthcare Henry podcast.
Thanks for having me. I'm excited. Thank you.
I'm smiling. People are like, oh my God, this guy's a dweeb. And I'm like, no, you guys don't understand. You are the reason why I got into social media. We talked about it briefly, but man, when I say to you, my son's mom sent me a video of this man with the glasses in a chair, and he was describing health equity. And she's like, Henry, I think you should take a look at this. And because I'm camera shy, right? I've gotten better now, but super camera shy. And you were the one. And I was like, oh my God. And I have literally watched you probably every day now for 365 days straight. Wow. So this is a full circle moment for me where I was like, I actually feel like I've made it now, man. So I really thank you for coming on the podcast.
For sure. Thank you again. And as I said, it's an honor just to be able to share this space with somebody who's also in the field of health and somebody who's also an advocate for others in that same field. So the honor is also mine.
I appreciate it. So I want to make first one distinction when we're talking about doctorate degrees and what it is that you do. Can you give us a little background history on what exactly your doctorate is in?
Sure. My doctorate is in public health. And so for those who don't know what public health is about, public health is all about preventative medicine or the science of how to prevent disease. So when you think about healthcare, you have two main components. You have proactive side of healthcare, and then the reactive side of healthcare. So the proactive side of healthcare says, I will eat right, I will sleep right, I will read the proper health tools and resources that I need to in order to have the best health outcomes. I will take health literacy to the best level, the next level. Reactive healthcare is, I either have tried those things or I have not tried any of those things, but I'm in a situation where I need to see a provider. There's either a health emergency or an issue that has come up in my healthcare journey that needs a physician's or provider's attention. And so public health really focuses more on the proactive side, not the reactive side, but the proactive side, which it stresses the importance of education on diseases such as high blood pressure, diabetes, COPD, things that you may be able to read or learn about that can be tools in your toolbox at your home, at your job, at your place of, let's say, even the gym or wherever you are, that you can utilize to make sure that you are living your life to its best and fullest capacity. So my specialization is public health, but also health behavior. When I did my doctorate at George Washington University, I specialize in health behavior, which is the science of understanding why people make certain decisions as it pertains to their health. There are certain theories out there that show you how the mind works, almost this cross between the psychology of health and the outcomes when it comes to our own health journey. And so overall, that's the summary, that's the science, and it's truly just this preventative lifestyle and preventative approach to healthcare.
And I'm going to get right into it because we do hospice, right? And so one of the things for us is we see people at the end. So like pretty much their last 6 months or so. And one of the things, and maybe you could help me with this, I understand how the mind works. I get all that, but how important is that, or does it matter at all when you're talking to people that say, hey, you got to eat right? That's what you say, right? So that you don't have to take all these medications when you're 70. How do I tell somebody that when I go to I'm just going to say, I don't go. Let's say I go to McDonald's and a salad is $14, or I can get a cheeseburger for $1.99.
Right.
how do I tell someone on a fixed income that they should buy the salad, which is not, first off, not going to fill them up as much, right? And then they got it. So how do I tell them that? Like, what does it even matter if they can't afford it?
So let's start. This is such a great question.
Okay.
Because it reminds me of what health equity is. Okay. So before we even, I can't answer that question quickly because the fact that someone may not even be able to afford a salad because of pricing or maybe because of geolocation is an issue of itself. So health equity, again, it's this concept that fairness, justice needs to permeate healthcare. And the way I think about it is I love suits. I have a good 23, 24 suits. I've been wearing suits all my life. I'm just
got me beat.
I'm just fascinated with them, and I love a good tailored suit. Right?
Same.
I mean, it has to fit you like a glove.
Yeah.
You know, and a good tailored suit can last you a long time. And so I think about health equity like a good bespoke tailored suit. You can go into a nice store, and you might see a suit that looks like it could fit you, but when you put it on, right? It technically might be your size. It might even be the right length, but it doesn't quite fit you like a tailored suit can fit you, because the difference is a suit that fits you is not the same as a suit that was tailored for you. Right. Say that one more time. A suit that fits you not the same as a suit that was tailored for you. And so when you think about health equity, there are circumstances in which people don't have tailored situations or tailored outcomes based on where they are. So for the person who is not able to afford a $14 salad, I wouldn't actually tell them to buy the $14 salad over the $1.99 burger. Matter of fact, I wouldn't even try to make a decision with them right then and there. I would say, tell me what you have. Let's see what you're working with. Let's see what resources are available for you. There are community resources that are sometimes not under our awareness. They're under the radar. There are local farmer markets that sometimes donate extra produce every single week. I know here in Maryland, where, and I don't know if you know about this, you might, but not all produce goes to market because of what we call cosmetic defects.
I did not know that.
So there was a program that I worked with years ago, and what they would do at the end of the week, local farmers, they gather their eggs, they gather their fruit, they gather the vegetables that sometimes you see like a vegetable, instead of having like a one broccoli head that looks nice and streamlined, it might look a little jagged to the side. Carrot, right? A carrot, you think of a carrot being nice and streamlined, but then, you know, it might have some on the surface deformities, but the carrot itself is still healthy for you. It's still, you know, edible for you. Sure. Just, you know, people in the market, like big consumer shopping centers, may not be able to say, oh, this looks good. So I say that to say there are resources that I would sit down with this person to see what's available for them, because I truly believe that it is not right for a one size fits all approach for Americans in general. Everyone has a different situation. For another example I could tell you is in Baltimore, in certain parts of inner city Baltimore, you can't really tell somebody, oh, you know, you're overweight, go outside and exercise. Well, their outside might be a concrete jungle of sidewalks. A backyard, and you're telling them have access to parks, and you're telling them go outside and exercise. You're telling them it's as simple as going outside, where these environments may be stressful for them at certain hours of the day. Their cortisol levels are more likely to rise, leading to higher rates of, you know, illness and health outcomes that are not the best for them. So it's all to say, how would I address that? By sitting down with that person, seeing what they have in their toolbox, seeing what I have in my toolbox, and taking community-based resources and applying them to make sure that they get their needs met.
That's interesting. So then the next question, and of course for me, is I'm always looking at, fortunately or unfortunately, however you look at it, the business side of this, right? Who benefits from having this type of situation in place, right? We know who suffers. That's the person in that situation. But I guess for me, who actually benefits from people not being able to have, I'm going to use the word that you use, being able to be proactive versus now having to be reactive? And is that only for the underserved community? And why is that? Who benefits from that?
I would say like this: we live in a society that is based on an economy that runs by capitalism.
Yeah,
And so
100%.
capitalism is the idea that we create private markets, private goods, and you can set the price that's appropriate for your desire. With that being said, it's not the easiest answer to give, again, because you have this structured society that was here way before you and I were here. It's embedded into our system. And so the people who are benefiting are not the patient population, right? It's not the marginalized community. It's not the undersourced and underserved. It's often those who have the big dollars in their pockets, sometimes corporations, and it's a very capitalistic model. Now, capitalism has benefited, America for hundreds of years, but the question is, when does capitalism become harmful? And if we recognize that harm, how do we address the systemic inequities that has been caused by this structure to then render good for those who are not able to benefit, as compared to maybe groups with higher rates of access?
But what about the actual person or company that benefits, though, right? And you get, so I get what you're saying. I understand what you're saying. But for me, I look at everything like you do holistically, right? So if I take, why is it beneficial? Let's take our employees here at the Precious Hospice. One of the things that we always say is, or I always say, and it just had this meeting, literally, she could tell you, I said, even down to our CNAs, everyone has to have health insurance. I know it's unprecedented. I know it's something a big company would hardly ever do. But in my head, the healthier they are, more beneficial they be, not only to myself, the company, but most importantly, to their own families and the people they're taking care of, right? So that's me on the proactive side, right? Mm-hmm. What company or what person in their right mind would say, we need to do the opposite? How would I benefit from that? Like, where does that come from? That mindset come from? Because to me, I hear you, right? But capitalism to me is, I need people working. I need people being taken care of. And if they are in good health, they can do a better job of doing their job.
Right. Well, I think what you are alluding to is
no, not me.
well, I mean, there are industries, and I won't specifically name the industries. I'll put it like that. There are industries out there that benefit when, individuals cannot afford. There are industries out there that benefit from certain classes being pushed in one direction and other classes being pushed in another direction, if you catch my drift. For example, here in the DMV area, I can tell you, it's really interesting where I can be in DC and I see the resources allocated to people in Georgetown, what they can afford, can access, who their purchases are benefiting. And I can go to Southeast DC, just opposite in direction of the diamond. And it's almost a completely different world, a completely different geolocation, a completely different ecosystem of finance, of access, of barriers. And so at the end of the day, those who are benefiting from the, I guess you can say, under-resourced system, under-resourced happenings of others are typically those who are pushing pockets with the end goal of finance versus care, which is why proactivity with public health is so important. Because unlike companies who focus more on, benefiting when others are sick because of their under-resourced stipulations, you're focusing on preventing burden on the hospital and healthcare system, which some people, CEOs, admins, directors, you name it, may not like, because at the end of the day, it's a paradox. And so I think the most effective way is for public health to be this ideal of focus on making sure that individuals get not only the care that they need before they need it. I want to say that again, the care you need
before you need it, yeah.
Before you need it, but also the tools for their toolbox to make sure that they can have as many resources at their disposal to help them navigate any health issues that may come up, or also help them be able to advocate for themselves. Because a lot of times you see individuals who are under-resourced and marginalized, they're also dealing with this lack of self-efficacy, this lack of being able to embrace the idea that I can stand up for myself in the best way forward. And a lot of it has to do with also, sometimes people don't know how to advocate for themselves. When you go to a doctor's office, when you go to a provider, when you go to a clinic, they say one thing at the clinic and you don't know how to ask questions. You don't know, sometimes push back. Sometimes you don't even know that you can get a second opinion. Right? And so it gets wide and it gets deep, but there are systems that are in play, and the whole goal of public health is to make sure that as those systems can be slowly broken down, people can get better access to care that gives them better outcomes, that allows people to live healthier lives, knowing that they have not only their best interests at heart, but the community and community resources and public health leaders also have their best interests at heart as well.
So that's an interesting point. And then the thing for me, what I see a lot of and I'm just going to be frank, in the Black and brown community, is a lack of trust in this healthcare system. And for good reason. I'm from the South Side of Chicago, and I've always been the one to say, oh yeah, I'm very reformed. I went to Morehouse College and I became a gentleman. All right.
Yes.
It's like I told you, it's like, no, I'm from the South Side. But the thing that I always tell people is, like, coming from where I come from and in having to go to Morehouse was a complete change of lifestyle, culture, the way I thought, what I knew was possible. The majority of people where I come from will never leave that area, whether it be they can't afford to leave it or whatever. But how do I tell someone from my area of Chicago who watched their grandparents be lied to, who watched their parents be lied to, who were over-medicated, who had bad jobs, who could not get good food? How do I tell that person to even trust the healthcare system when they feel like it was put in place to keep them down, or to even, for lack of a better phrase, keep the actual population at a certain point where they wouldn't live as long as their white counterparts?
Oh man, again, all of your questions have been excellent, because you can't answer any of these questions with a simple sentence. They're deep dive questions that cause reflection and true internal processing. Because to begin with this answer, right, you have to look at history. In order to understand the past, you have to understand what the context of each historical situation was. So we know about the Tuskegee syphilis experiment done by the United States Public Health Service. We know about, there's a story of Bruce Tucker. Bruce Tucker was a man in Virginia, went into the hospital, passed away. His heart was removed without knowledge given to his family. No consent was given. And it was then deemed as Virginia's first heart transplant that was done on a white man, knowing that it was a black man's heart, and the black man's family never knew until after the fact. I can tell you
what that reminds me of.
Yeah, of course. Come on now. I can tell you so many stories, like Abcade, a worker who was working on a project, construction worker working on a project, goes to the hospital. You know, white doctors perform plutonium experiments on him and do radiation experiments without his knowledge. Vertus Hardeman, similar story, 13-year-old. I can go tell you radiation experiments. And so why do I tell you all this? Well, because I don't believe in ignoring the elephant in the room. I'm not here to just talk about the need for Black and brown communities to check out health. I'm also here to say I understand you. I know why you feel this way. I know my family. My dad is from St. Lucia. My mom's from Dominica. I'm a first generation American born in Brooklyn. I understand the context. My dad, he's better about his health now, but still sometimes carries that sentiment of, why do I have to go to the doctor? Why do I need to go to the providers? Because there's something called generational trauma, and it's a real thing.
It's a real thing.
Studies have actually shown that the fear of providers from Black and brown communities, experienced within Black and brown communities, has been passed from generation to generation. And so this 100%. Is this phenomena, right, of generational trauma being passed down, where you are more likely as a Black or brown individual to suffer with an illness, or be silent on that illness rather than go seek help because you cannot trust, the system, because the system, right, we know that to be built predominantly by white male colleagues or individuals.
But do you trust it though? Do you trust it? And as a
and I can tell you, okay, go ahead.
As well, you just told us, right? You said that you are first generation, right? You are literally first generation. So your parents did they come here so they were immigrants?
Yes, they were immigrants.
And so do you trust, and you can answer this how you like.
I'm going to answer directly.
Okay. So do you trust the system that as of last week, has people in place that is literally running around with machine guns and in military outfits, going up to doors, looking for immigrants? You trust that same system to treat you with your healthcare needs?
So this is my nuanced answer, right? The system is not necessarily what I trust, and I'll tell you why.
I love this.
The system is built by individuals who have sought out empowerment for themselves, their pockets, their lifestyles, their luxuries. The system was never meant and designed for me to exist today. The system was never meant for me to be where I am, a leader in health, a leader in equity, a leader who's all these things. But here's who I do trust.
Okay.
I do trust the individuals who are in the system, but not of the system.
Can we write that down? I think that's a quote for today. Yeah, I love that.
Yeah.
And that's how you make a change. You're right.
Because here's the thing. Throughout history, you have seen time and time again, Black and brown communities have been disproportionately affected by negative health-related either research, interventions, initiatives. And it's only in the past 20 to 25 years that truly, I believe, we've made some more progress, because there's been a lot of highlight on these inequities. And I believe even in the past 5 years, we were really at a point where now people aren't afraid to speak up about equity. However, we are living in a time when equity can't even be a word you say in certain states, in certain areas, in certain regions. Where am I getting with this? Well, at the end of the day, when you think about this concept of equity, and you think about this concept of fairness, and you think about this concept of justice, there are people, again, who are not agents. They're not agents of the system. They may be agents in the system, as I said. They're not really there to serve the master, so to speak. They're there to serve their population. I'll give you an example. For prior to my current role as a health leader, I was working for the NIH for 5 years. Okay, I worked for two offices in the NIH.
Mm-hmm.
I worked for the Office of Infectious Diseases,
Mm-hmm.
and I worked for the National Center for Advancing Translational Science.
Okay.
While I was there, you definitely had a different feel based on who was in office.
Mhm.
Priorities were different, regulation looked different, baseline reporting looked different. But why do I tell you this? I tell you this because people, especially during COVID, and when I say people, also I primarily mean my people, Black Americans. They would.
Sure.
Why are you working for the enemy? Why are you a barrier of progress? Why did you sell your soul? I heard it all, man.
Oh, you sell your soul is crazy. Did they say that?
They did. I've had people truly try to even. Anyway, we're not going to go down that route, but they were truly expressing their disdain, and I said, listen. At the end of the day, I find joy and I find peace in making my voice heard, even if I'm the only one advocating for our community. Now, at the time, I was working with many colleagues who, and we're not, NIH is not, meant for one population. We're doing research on Latinos, Latinx, Indigenous, Southeast Asian, African populations, Caribbean, South America, like we're doing research in all different ethnic groups, culture groups, backgrounds, race. But I just felt like, hey, I don't see always a lot of people like me in these kind of positions. So why not let my light shine and see
Yes. Yeah.
what's the best way to make sure that this ladder that I climbed, I get it back down. Either I'm sending it back down for someone else to climb up or for someone else to get information that can benefit their family that they may not have known of. And we talk about health being wealth.
Yep.
Health being wealth, the fact that in order for us to live the best life and see the wealth that we might have in the financial aspect, we need to be able to take care of ourselves. And it's common. Literally, Kev on stage just made a video. I don't know if you've seen it, where he posted that he just got his annual physical done. All the comments were,
I did see that, and they're like, "You just told us you wanted to get a prostate exam without me getting too vulgar." It's comments like that. Yeah, I saw it. Insane.
But it's an extension of our conversation. These are people downplaying the importance of what it means to go to a provider, what it means to go to a doctor, because
really physical. That's what it was. Yep.
There are people who are misinformed. There are people who are disinformed. Quickly, for those who are listening, there's a difference between misinformation and disinformation. Misinformation is I told you something that's not correct, but it was not intentional. Disinformation is I intentionally gave information knowing that it's going to steer you in the wrong direction.
Yeah,
so misinformation, disinformation, and you have these people who are also just generational trauma. Fear. Sometimes that fear has not been addressed. So going back to the first point, the best way to address, hey, do you trust the healthcare system? The system cannot necessarily be trusted in itself 100% because the system was not built again and designed originally for people like me to exist in that system. That is the truth. There are books I can recommend on it. There are sources I can show you, PubMed, JAMA, it continues. But I still believe, I'm a strong proponent that there are people they're in the system, but they're not of the system. And they're here to make sure that system reform happens. It's not always overnight. But system reform can happen. It'll take time. How long? That's a good question, right?
Well, it is, but how many people like you do we have? And that is one of the concerns that I think people feel is saying, hey, you're saying, hey, I'm Dr. Forde. I'm coming here to actually help y'all and pull you up. And too many times I even look at people in power who have access to information, who have the ability to pull down and reach people up with them. They don't do it. And we see that over and over and over and over in our community. Then you have that crab in the barrel mentality, right? Like I made it, or I pulled myself up. You figured out how to pull yourself up. And I think it is difficult for someone to hear you say, I believe you, right? I 100% believe. But the average person is like, nah, man, that's not, you're going to change.
Right.
Like, they're going to change you. Like, how do you combat that? Not even just for you, but even for me or anyone that's in our position that they're looking at and saying, Henry, you crossed over, you're somebody different. So I'm the same person, man. But how do you explain that to someone that looks at it and doesn't quite understand what you're trying to accomplish?
I think, you know what, it's a very cliche answer, but it's really the truth, where I try to be the same person online that I am offline. And I know you might be like, where are you going with this? What do you mean? But the truth is, you give that example. There's some people who might have, a bigger platform than me, millions of followers, more power, more reach, more, you can say, just influence, right? But they might not speak on these things. And then someone like me comes along and I speak on it. How do I make sure that my messaging stays consistent and is received in a way where people can digest it? And for me, it's like, in person, I try to keep the same energy. I don't want to do it just for the views, just for the likes. Matter of fact, I made a vow to myself very early on when I started this online journey. The vow was, I would never change my values, I would never change my morals, and I would never change my purpose, because my purpose was always to make sure that individuals that may not have known some of the stories I tell about Black history, whether it's medical injustice, present day injustice, whether it's me leaving actionable items at the end of the video just to spread awareness. I'm doing this because I know that there's an issue, and I know that there's a problem, and the problem always starts with distrust. But if I can even get one person, just one person, to say, instead of being afraid of the system, at some point you're gonna have to encounter it, right? Like even if you never go to the doctor, what happens when you end of life? Yeah, at some point you will have to go to a physician. Don't ignore the system when you're going to have to run into it at some point. But what I would encourage you, which is what I would love to talk to people about, instead of running away from, understand the system, understand the cards that you were dealt. Understand that it may not be fair, even though we're preaching health equity, it may not yet be fair for you. But understanding that where you are, there's still resources, there's still people like me, like you, who can pour into the person who wants to take control of their health. It's so funny because I think about it, and we schedule time for meetings, we schedule time to pick up your kids, schedule time to even go to the gym, but we don't always schedule time for informing ourselves on what is the best direction for our health. What is the next best thing for me to learn about how to manage my condition or how to prevent this condition from occurring. Just the other day, just full transparency, I had an annual as well, right?
Okay.
Just like
I won't ask you any of those questions. We won't ask you those questions.
But I went and I realized that I needed to do some things better. Just straight up, I needed to do some things better. And part of that was me not getting enough sleep.
Man, when I tell you, I don't know if you saw this or not.
Yeah.
I was so stressed out from work. And I did a video about this. And it was about maybe 3 months ago when Dr. Stanton died. A couple months ago.
Okay.
My blood pressure was so high. They won't even let me say how high it was. It was so high. And I get a call from one of our consultants, and she says, "You don't sound good on the phone. I'm coming over there." And I'm thinking I'm fine, right? Whatever. She comes by. She says, "Check your blood pressure." I check my blood pressure. She said, "Oh, you're going to the hospital now." This is literally 2 months ago. So I ain't going to no hospital. I know what they're going to do. Just send me to the doctor's office. It's like 7:00. You had to move some people around, get some things together where I can get, some fluids in me or whatever. And we get there. She said, "You got to meet with a cardiologist." I said, "Okay." So 2 weeks go by. She puts me on this medication, meet with a cardiologist. Cardiologist is about 54 at the time. So I met with him 2 months ago on a Thursday. No, yeah, it was a Thursday before Thanksgiving. This was before Thanksgiving. And he sat me down. He said, Henry, I love what you're doing online. He said, but what is your goal? I give him my goal. I give him the projects I'm working on. He says, forgive me. He said, you're doing too damn much. I said, no, man, I'm not. I have a responsibility to, and I said just like this, to my ancestors who were slaves to do better. He said, no. He said, no, you trust me. You're doing too much. He said, I need you to get more sleep. I want you to calm down. I don't want you lifting heavy weights anymore. I want you to focus on self-care for you. And I said to him, man, I'm not doing it. I'm 37. I'm good. I don't need no self-care. I don't need no massages. I'm getting up and going back to work. He said, well, you gonna take this medicine? I ain't taking no medicine, man. It's like, I'm not doing it. Mm-hmm. He said, Henry, I'm 53. When I was your age, I said the same thing. And now I'm on 3 blood pressure medications. He said, you don't have to do that. Just do what I'm telling you to do and you'll be fine in a year at max. I said, all right, I'll think about it. I actually took another doctor with me to the appointment because that's just how they do me. So I go there. I would say 4 to 5 days later, I get a call. He had died. Black cardiologist. God bless his soul, Dr. Kelly. And when I tell you, I can tell you word for word everything he told me in that meeting, where it was like, yeah, he wasn't joking. Like, this is real. And so to your point, this is a cardiologist.
Yeah.
If he struggles with this stuff and he knows what to do,
yeah,
what do we tell a person who doesn't even finish high school or doesn't even get to college and doesn't even understand these things? How do we tell them, or what responsibility do we have, you, I, doctors, whoever, medical doctors, whoever, to give them this information? We talk about misinformation, disinformation, but is it our responsibility to share our stories so that they can also get to a place where they don't have to go through the same things that we're facing or that doctor might have had to face?
Right. Definitely. 100% a responsibility. I mean, rest in power, Dr. Kelly, right?
Yeah, Dr. Kelly. Yeah, man.
That's definitely a crazy story. But I think going back to, the points before, like, when it comes to taking care of our health, you really have to make sure that, number one, we are thinking about stories. The Dr. Kellys who are telling us, like, watch out for this, be careful of that. Here's a warning sign that you might need to heed to. Because at the end of the day, when we don't pay attention, that proactive nature of public health can eventually lead to that reactive nature of health scares.
Medications, yep.
Medications lead to emergencies. And so the overall point here is our responsibility, given the knowledge we have, given the access, the resources, because as you pointed out, you said you're from the South Side of Chicago. You said there are people that have never left that area. You said Morehouse gave you an experience that changed you, that gave you opportunities and access and open doors for you. There are individuals that we need to make sure we do not leave behind in this journey we call life. The greatest gift that we can give our fellow man is the gift of purpose-driven care and purpose-driven encouragement. Purpose-driven care and purpose-driven encouragement, because the care that you give them has to come from your purpose of the why you are here doing what you do. The encouragement that you give them has to be from the why, rooted in the purpose of what you do. And the why, your why, should always be, no matter what specific why you have, what specific purpose you have, a gift to others that can still be given when the world says goodbye, when you say goodbye to the world. When you're gone, what have you left behind that can still give to people? Or even as you're here living, what can you give to people, right? giving them your time, your knowledge,
Yeah.
your resources. This is a gift that is rooted in purpose. And so going back to your point, you know, you went to the hospital, the healthcare provider, you had a scare, but how many of us are having that scare regularly and wiping it off because it's not truly a scare yet? Matter of fact,
Mm-hmm.
I'm on a project right now, and in that project, I was doing some research, and there's a cited research document that actually says, on average,
Mm-hmm.
on average, Black Americans live about 3 years less. They have about 3 years less life expectancy than white Americans. And a lot of it deals with stress
Oh,
as it pertains to work, stress as it pertains to navigating environment, stress as it pertains to navigating life in general. We talk about disorders, but also when it the stress of being late to your health, showing up late. Like the clock has already struck 12, and you're hoping that you can have more time, but there's not much time left. So
that here's the thing, right? And I'm gonna tell you the truth, right? Because, and I think that I'm gonna use decade-long data of owning a hospice. This is the end of life, right?
right.
Is it true that, in my opinion, from what I've seen, Black people have 3 to 4 years less than our counterparts? I would argue it's somewhere around 8 to 10 years if they were to take people from the same areas. So what I mean by that is, if I take a person, because environment plays a huge part on so many different health factors that people don't take into account. We have one in Chicago, Indiana, and Atlanta. Let's just use Atlanta. When I look at Atlanta and people are like, well, I look at areas that is like the majority of the area is Black people. It's a food desert like you've never seen before in your life. The moment is gentrified, when I do mean the moment is gentrified, Trader Joe's pops up. And I'm like, whoa, wait a minute. So you're telling me you all always had the capacity to put a grocery store that could get fresh produce to a certain amount of people, but you chose not to do it until certain people came into the area. And if that's strictly a money thing, meaning that only these people could afford it, how do we do that, right? How do we justify that? And so, like what I asked you earlier about the medications, whether proactive or reactive, however it is, what doesn't matter, whatever it is. Even the people who go and live a life where they tear up their insides, they smoke, they drink, they eat bad. Another part of this that isn't talked about enough, especially now more than ever, and I really want to get your insight on this too. Access to medications, strictly because of insurance barriers, is going to be more of a problem in the future. It's more of a problem now than I've ever seen in my life. How do we help people, even if you lived a terrible life? That doesn't mean you have to die tomorrow. How do we help them get insurance? You are a health equity expert. That is what you call yourself. That is by far what I'm going to call you, just from talking to you for 40 minutes so far. You are an expert. How in the hell do I get them quality health insurance? So even if they did live bad up until 70 or 50 or 60, they don't have to die tomorrow because they can't afford to go to the doctor to get the blood pressure prescription.
These questions are...
Take your time.
I have my answer.
Okay.
I have my answer, but it's just much. I just have to say, I've done a lot of these podcasts and talks, but these questions are almost top notch.
Thank you.
Cable news, time questions, because the answer that a lot of people will tell you might be connected around, well, I got to plug them in with this resource, or I have to find this person that can help them get the health insurance that they need, or I I can, I've heard it all, but the truth of the matter is, and it's the ugly truth of the matter. Look at who are the people writing the policies preventing health insurance from being as affordable like it can be. I'll give you a hint. It's not this back of my head.
Here's my thing with that, though.
Predominantly. Okay, go ahead.
Here's my thing with that.
Go ahead.
And because I am, and anyone will tell you, I come from a place where I know racism exists.
Right.
But what I've witnessed,
yeah,
in hospice specifically, because that's where I get a wide view of different diagnoses and things like that.
Right.
A lot of what we play out to be as racism, is it possible? I'm just getting your perspective. That a lot of it, we don't play enough into classism versus just so much of it in 2026 anyway, specifically being about racism.
So I love that you brought that up. And so I'm going to go back to the historical context of this structure, like how we even got here. So the reason I had brought up, and this is not an attack by any means on, people who are white. It's just looking at facts and looking at them clearly. Predominantly, the people who have always had the most power in policy have been white men. Traditionally speaking, this is not something that I'm making up. You can Google it. You can fact check me live.
No argument there.
Right?
No argument there.
Throughout the times, different groups have advocated for their rights. Different cultures, different ethnicities, different races, different genders, different backgrounds have advocated for their rights. And I learned something a long time ago that really changed my outlook and perspective on policy. The people who make the policy can sometimes influence it in such a grand way that you don't see the effects right away until years later. And policy only looks as good as the people that it's serving. So going back to the classism approach, yes, I actually agree with you that sometimes, right, it may not be such as black and white as a race issue, and it may be a classism issue, but then I reverse uno.
Okay.
And say to you, if we look at only classism, is that classism rooted in race?
So then I'm going to say, right, because I mean, no matter me, I'm going to say the truth. So then the truth to me is, unfortunately, and I ask this question all the time to people because I am always in shock at how presidential elections always end up. Let me say it. You'll get where I'm going with this. Always in shock because the majority of the country, which is the majority of the country, is going to be, for lack of a better phrase, lower class in the next 5 to 10 years. Vast majority. So just follow me. Vast majority. Yet we as a country, find that it is better to vote for people whose interests only interested in the interest of billionaires. We literally have people who make $25,000 a year trying to argue with me on Instagram as to why my views are inaccurate, my views are wrong, and I have to sit here and read this and say to myself, one of two things has happened in America. I don't know who said the quote, but I'm going to say it anyway. If you can convince the lowest white man of sorts that he is better than the greatest black man, then you win. And that's where we literally are right now.
Of course.
Right?
Of course.
So when you're talking about, is it a byproduct of classism? These people have been tricked into believing that if Trump decides, if this administration decides they want to pull SNAP benefits, they only pulling it from people that look like Healthcare Henry and Dr. Forde. That's literally what we thought. So to answer your question, do I believe that is a byproduct of racism or comes from? I almost want to say no, man. I think that unfortunately,
Yeah.
when we're not 1,000 years away from slavery, right?
No,
That's the other thing.
not at all. Not at all.
It's not, nah. My grandfather's grandfather was a sharecropper. Be honest.
I literally spoke to a lady yesterday,
Mm-hmm.
connected with me on one of my videos, who said her father was a sharecropper.
There you go. So they don't even understand how can they be the bottom, right? How can they have gotten there? So I look at classism and I say classism is the new racism. I don't think people realize it yet. But and I'm not saying it is because, oh, Henry, you don't understand. Oh no, I understand. But what I also understand is the same way when I walk into a hospital and I talk to a family, it doesn't matter if the family's white, blue, black, orange, purple, green, whatever.
Mm-hmm.
If you are indigent patient, which means you have no insurance, you are not going to get better treatment because you're a white man anymore. Let me just be very completely honest with you. It's not going to happen. It's not going to happen. So I think a lot of it nowadays is classism. And I think, I'm not a politician yet, or I don't know if I ever will be, whatever. I think that if we can convince people, and I want to get your thoughts on this as a public health expert, if we could convince people that we're all on the same playing field now more than ever, could we then come together and be more productive as a society?
That is the ultimate question, and that'd be a perfect society, at least more perfect than what we have now.
Sure.
But the truth is that's never going to happen.
I think it will. I'm going to tell you why.
Why? Tell me why.
So every now and then, she'll tell you, I still go see families in the hospitals, right?
Okay.
What has happened this past 6 months to a year now, roughly? I'm going to still say 6 months. 6 months. I can go into a room and I see a family. And I know right off the bat by how they talk to me what their political affiliation is. I can tell right off the bat. The difference, though, versus 5 years ago, it doesn't matter what political ties you think you have.
Right.
It all comes down to, do you have insurance or do you not have insurance?
Right.
Do you have SNAP benefits that were taken from you or do you not have SNAP? I'm telling you.
So you know what's interesting though?
Go ahead.
And I know, so I'll tell you why I said I don't. I think that it could change, but it will. Here's why. That same situation, it's so funny because 2 weeks ago,
okay,
my wife, she's a pulmonologist.
Okay.
She works in the healthcare system, and she shares stories with me on the regular where someone is in a similar situation. Literally, I'm thinking of the story right now. Similar situation, insurance lapses. Right now, you get into this more awareness of, is this a classism thing? Is it me versus them? And yet they go through the same issue of not having coverage. They're still blessing the other indoctrination, the other person, the other belief of systems that there's someone looking out for them, and I'll give up my SNAP benefits if I have to, if it makes you get where I'm going with this. I'll give up my. I literally heard from these people's mouths, I'll give up my SNAP benefits if I have to. I'll give up my insurance if I have to. I don't mind losing my benefits if that makes America great again.
That's interesting. You said if it makes, and that's interesting.
So and I can say, but also in all fairness, maybe it's a geographic experience too.
100%.
Because I can tell you that the patients who spoke on this thing were in the region north of Baltimore, not Baltimore itself, the region north. You get me. It
I got
you see what I'm saying? And so I'm assuming you're dealing with maybe people in the Atlanta metro area.
which goes from $20,000 household to a year to $10 million. We have all types of patients.
Yeah. So it could just be, maybe it's just what in research you just said it had a small sample size. That could have been it. But I will say this. I do see your point. I do see it. And I think that and this is a big if for me, but if we can get individuals to be focused more on the unity that can be seen in advocating as not by necessarily, being against each other by race or being against each other by culture, being against each other by ethnicity, but just, this us versus them mentality of let's go after what's ours when it comes to bigger corporations, bigger industries, advocating for better policies. You strongly could have a better outcome. But again, the politics of that is just so messy that it's not even as easy as I just said it. And the only thing that I see as race still playing a factor is because there are people out there that say, oh, I don't see race, I don't see color, race is not a prevalent factor that I observe or I bothers me or whatever. But when classism fails, something else has to take its place.
When people tell me they don't see race or they don't see color, I immediately don't trust them. Immediately, because we all see it, right? Doesn't mean that one is better than the other or anything like that. But the moment you tell me that, you've already lied to me. I do not trust you going forward. So anyone who asks me, if I'm ever in front of you, say, I don't see color, you're just a person in front of me. I say, no, I'm a black man in front of you. That part is obvious. What you should say is, I don't see you as being any different from me, but my color is blatantly obvious, right? I immediately don't trust him.
I grew up in rural North Carolina, so I was born in Brooklyn, but I grew up in rural North Carolina, and I got that a lot. I have black friends. I'm not racist. And I even got people do the microaggressions. Oh, you talk so well. You're so educated.
Oh man.
I didn't have the terminologies to pinpoint what was happening with me at that time.
Yeah.
But it came to the point of, we're different. It's okay. You can acknowledge that, but I think the beauty is acknowledging that you can see me as someone who is different from you, but you bring something to the table. You bring something to the conversation. You bring something that is valued and that will not be dismissed, overlooked, or undermined. So
when we look at that, and this is just, are you religious at all?
I am.
Okay.
I'm a Christian.
Okay. I look at, and I've had this discussion a lot the past couple weeks. People ask me about what I think.
Sure.
I think a lot of our views in America, we have single issue voters. What happens with that? They take something like, I'm a Christian, I don't believe in abortions. And that is the very basis of how they vote. On a county level, on a city level, state level, and on a federal level.
Sure.
Is it possible that we first have to dig into that to get people to understand? Or, because again, this is all public health as to why would someone vote against their own.
Yep. I got you.
To actually.
I got you.
For what reason? And that's what I keep hearing. Well, I don't believe in abortion. I said, well, you're okay with losing everything because you don't believe in abortion. How do we fix or at least get them to understand there is never a one-stop fix for anything? And the compromise, sometimes what we find, whether you agree with abortion or not, I get it, is, am I going to say I'm going to vote for this person who does not have my interests at heart at all, simply because my religion says, in my opinion, I do not believe in abortion?
Ooh.
Take your time.
Questions. These.
Take your time.
I will. You know what's so funny? I've had, as I said, I've had a lot of these podcasts, a lot of these interviews. I will say, I think these are the best questions I've ever had in my life.
We have the best team. Do you see Tashina over there? We got the best team.
Like in my life, like I'm not even.
Oh, wow, thank you.
I've probably done, man, last year alone, I did probably like 20 to 25 conversations like this. And I just, this is like the thought provoking. These are the classroom discussion questions that the teacher has at the end of the session. And like, you don't want to leave the class because you want to answer that question. I don't have the best answer because it really, like, to think about changing the mindset of a group of people with this type of mentality really requires national self-reflection. Not everyone is ready for that. Not everyone look inside the heart. Not everyone is ready to relinquish ideas that don't make sense because it makes them feel better about who they are. Not everyone is ready to accept the truth, which is factual, which can be proven, because they rather hold on to something that feels comfortable and gives them a sense of pride. And so that's why the answer is not as easy, especially because, I mean, I can give you all the flowery words in the world that sound good on paper, but when you have the intersection of health behavior, policy, and politics / administration and leadership, what happens often is that politics leads down to trickle onto policy, and then policy leads down to trickle out to health behavior and health outcomes. And so if you can make people feel good about their vote, and the Dunning-Kruger effect takes into play, where your mouth is saying all the best things in the world that sound good, but the intellectual basis for what you're saying is absolutely zero. That happen if you can introduce the straw man argument, where, you know, for example, the straw man argument, and not to get into politics, but we
no, take your time. I'm fine.
Right here, right? J.D. Vance made a statement recently saying, "Oh, it's about time in America that we don't have to apologize for being white." So the straw man argument, it's a concept. It's a theoretical concept that says, I will give you a different issue that was never mentioned, but then cause a stir that takes people away from the issue at hand, because then we're like, we never made you white people feel bad for being white. Well, what is this? We never said that. But then when you put this onto the healthcare lens, you look at this through the healthcare lens, you know, it's easier for certain groups, especially by religious affiliation, to feel that the gospel is leading them to a particular party, a particular vote, because, you know, either God told them, or they spoke to him, or they read it, they feel convicted, and all these things. But sometimes sometimes I'm convinced people confuse their conviction with self-conviction. And I'll make a clear statement. They confuse what they feel to be convicted from God, which is what they were actually convicted by convincing themselves. True.
Yep. 100%. 100%. I gotta ask you, because I don't want to harbor on politics too much, because then I get a whole list of crazy questions and people coming at me. But AI, right? Artificial intelligence, public health. We look at now the data and being able to aggregate this data to get better outcomes for people across certain sectors. You focus, from what you said, majority of your work, it seems to be, is on the underserved, which is Definitely, we applaud you for that.
Mhm.
There are two sides to AI and the underserved. One, AI can be very helpful.
Mhm.
It can help us predict outcomes based on where people are, their behavioral patterns. And there's another side that says AI, because it was built by racists, is going to be intrinsically racist.
Mm.
Where do you stand on AI? How can it help us? And what can we do, or what can we put in place so that if it doesn't help us now, it can help us become and get better outcomes for the underserved?
Yes. So let's go to the statement of like AI and racism.
Okay.
So it makes sense, right? That when you build a tool, the builder has input into that tool.
100%.
So it also makes sense that if the builder has input into this tool, the tool has a likelihood to have contextual racist ideals if that is what the builder has. But AI wasn't built by one person, it was built by a system of people. So we talked about systems earlier. So then it becomes, how is the system of AI more, I guess you can say, enhanced to benefit others? And so we talked earlier about not being, not, you could be, being in the system but not being of the system. We talked earlier
Yep.
about in the
Yep.
system but not
Mhm.
being of the system. So I think the same thing when it comes to AI, because AI is helpful. It has proved effective in health related initiatives. It's proved effective in day-to-day tasks and outcomes. It's proved effective in helping your everyday life be a little better. And AI is in a little bit of everything now. Sometimes you don't even know you're using AI and you use it. But you know, am I someone who's dismissive of AI? I'm actually not. What I am dismissive of
I'm
is
listening.
how AI centers are being built in predominantly black communities and geographic locations where these huge repositories that take off the water access that is needed to regulate these systems. Sometimes it's built in the backyards of maybe low income housing, or sometimes a lot of black neighborhoods have been targeted, especially in the South. And I think, okay, what would it look like if it wasn't built in those areas? What would it look like if it was built in maybe predominantly higher class areas, or wealthier areas? Would some of the same policymakers have certain stances on just building where they would like not having the consideration of the environmental exposures, environmental issues as it pertains to where they build, what they build? But AI, as I said, it is useful, but I think having more agents of change being in the system and not out of the system is necessary to make it a tool that truly benefits everyone. I remember when ChatGPT first came out, there was an issue that I read about where two people of two different races could ask a question about their health, but if you gave one, I guess you could say, let's say your race was black and your race was white, just going, sometimes it may have left certain things off or not included as much information as possible. And some of the coders and the agents were like, yeah, we got to make sure we're on top of that. We got to make sure we stand by it. And so, AI is only, I asked this question at Afrotech to people, like, what,
Are you at Afrotech?
I was
there. I was there.
Really? Oh man. Yeah. I was there, and I actually asked people this very question. I said, is AI a racist tool? And the answer was like, hey, the tool is only going to have racism if the person who created it had those ideals, or the people had those ideals. And I think
Agreed.
because it's we have such a vast area of expansion when it comes to discovery and what we can do with AI, I think it's worth noting that those people who can help regulate it from a more equitable point of view are needed more than ever before, because it is something that can be beneficial. So from the environmental side, to where these data centers are built, to how it's utilized from the coding perspective, I think equity is needed in both ecosystems. If someone wants to ask me, well, I don't think you're making it a big deal. You're crying about it. Hey, here's the victim card. It's like, it's not about being a victim. All right. It's about looking at statistics, looking at data, it's looking at evidence. and how AI is being utilized, who it benefits, and then how we can make it a tool that truly is beneficial by all, for all, by the people, for the people, and it makes sense because at the end of the day, people are more hesitant to use the things that they believe will harm their own community.
Yeah. So I'm going to say this,
Mm-hmm.
even though I know I shouldn't. I don't care.
Yeah.
A lot of the problem with technology
Mm-hmm.
is we don't have but a certain type of people who code and program. That's the first thing.
Mm-hmm.
The second thing is we don't have, which is why I love Afrotech, and I'll give you the story on Afrotech in a second, but we don't have enough people who have access to capital to even build a bare bone model of something that we could actually use. Even here in our office, we built an AI system. We're building it now. It's probably it's very close to being finished.
Yeah.
And I'm gonna send it to you so you can see it.
Awesome.
But it essentially takes what you're saying, right? And it'll allow you to, or give you feedback based on your EMR. Hasn't been done before. It's extremely interesting, but I believe ideally, if we had more people to, like you said before, right? You may not trust the system, but you can trust the doctor that comes from your neighborhood. So if we had more people who built these things who come from where we come from, we would have better outcomes with these systems and programs. And of course, once people, not even just of our race, started using them, again, the majority of people are going to be low income in the next 10 years. I strongly believe this, right? So if we all had someone with that in mind, looking to help build it for them, like, how Fubu says, for us, by us. And I don't just mean for blacks, by black. I mean for us as in
collective. Yeah.
Collectively, the majority of people in the world, right? Because the only 1% is just the 1% for a reason. That's only the 99% of other people don't have access to that stuff. If you and people like myself, and this is where I'm going to challenge you, myself, and other people like us, we got to make time to have these conversations and build the products that we know people need. And we've got to figure that part out. We've got to get people like, you mentioned Afrotech. My first podcast was the Henry and Jeff show. And Jeff Nelson is the CTO of Blavity Afrotech.
So cool.
That's my dog. I mean, we went to high school together in the south side of Chicago.
Wow.
We ended up catching up randomly in Atlanta. We both, we were there for whatever. And we're like, bro, we got to talk, we get together. Next thing you know, he's like, I want to do a podcast. Again, I am anti-camera up until like a year ago. So I just tried it and I was no good. And I think he realized that. He's like, bro, you got to get better. So, but I've gotten better over the years, right? But no, he again, one of the people that introduced me to this. And it's like, he always tells me, come to Afrotech. He always makes the introductions for me at Afrotech. So I'm very grateful for Jeff for that, because to your point, going to a place, reaching back and pulling people up is like one of the things we have to get to. But when I look at AI, this is just me, right? As a person who's like, we've built now a system that, because even what we've built, it still, to some degree, looks at the background of the person. And that was something that shocked me. I'm gonna be honest. Even as we built it, I'm still wondering, how does it do this? And what it does is, not on its own, it's programmed this way. It also looks at what you have, what indications of cancer and other things that are in your family, and it puts together what your plan or what your future is going to look like. And what we found is, to your point, the most important people that should be building AI is not me, the entrepreneur.
Right.
It's not the guys in Silicon Valley. And I'm going to say this, I don't care who's upset about it. It's people like you. It's people like you. Like, you're the ones that we need to be funding. So if we sit down with you, you can probably give us 100 ideas just like that would actually help make America a better place.
Yeah.
We got these hats. I am like serial entrepreneur, crazy person, whatever. And it's like,
I love it. I could tell. You gave me the mindset. More. You said Morehouse, so makes sense.
Yeah, we got this thing, and there's this guy in America that has this thing called "Make America Great Again," right? And I'm like, yeah, okay. And we had this hat, and his hat says, "Make America Precious Again," and we crossed out again. So this is a question for you.
Yeah.
I know it's nothing to do with AI.
Yeah.
When we say again, because this is why we crossed it out, we don't get it. But your platform talks about, even one of your biggest posts talks about Dulles Airport and what it used to be.
Yes.
We did our research.
Yes.
When was America ever goddamn great? Where does that come from? Break that down for me and all of us listening.
But here's the question: great for who? Great for who? Great for who? You talk about America being great, but who was it great for? Was it great for certain races? Was it great for certain cultures? Was it great for people of certain backgrounds? Was it great for people of certain class? Who was it great for, right? And so, yes, getting into that video, you talked about this story of Willard, community of Willard in Willard, Virginia, where there were individuals who had the best community built for them, Black individuals. They had their farmhouse, they had their school, they had their church, they had their bank, they had their local produce market, they had their local, institutions of day-to-day commerce. And the government says, hey, listen, we need to build a new airport, right? They looked at multiple places. They said, your land is what we need. Here's the funny thing that I still to this day am not a fan of when it comes to eminent domain. So eminent domain is the principle that says, hey, listen, we are the government, we're the federal government, and we have the most power, we have the ultimate power. And because we have the ultimate power and the most power, we are going to be taking your land because by eminent domain, we can take land without question as long as it's for public use. And so
hold on though, because I don't want people to be confused about this.
Okay.
Most of the time, you are paid 2 to 4 times.
I didn't get that part. I didn't get.
I want to make sure people are. Oh, okay.
I literally, you beat me to it. You're going to get paid. I was going to say we're going to take your land as long as we give you fair compensation.
Sure.
So as long as we give you fair compensation, and it's deemed for public use. It has to be deemed for public use. You can't just be like, oh, we want to take it to take it. You'll get fair compensation. The problem was, what is fair? Because at that time, the community of Willard did not have legal representation. And there have been reports, because I actually got to link with some of the descendants of Willard, where their family members never got the payment that was promised to them.
Wow.
So, yes, it is supposed to be a thing where the government gives you fair compensation.
Wow.
But there are still reports, and there are also historical statements made by family members who said, well, my grandfather had to move and our family relocated, but no payment was received. Maybe there was a mailing address issue, but come on, it's like, if you tell me I have to move and I have to get fairly compensated, again, is it equitable? Is it fair? Then I get it. Those are the two big questions. And then the third question is like, why was it that area when there were what's crazy, there were other areas of land that had little to no community members. There was one in particular that I cannot recall off the top of my head, but it was barren farmland. But you rather take a community, right? And a lot of the descendants who lived in Willard, these are people who are coming from, times of hardship, times of, now they're making something for themselves. The descendants of people who sacrificed for them to even have that small community, and now that community was almost eradicated in a way, vanished in a way. And so bring that up to say there's a lot that goes on even today. We have modern versions of this all the time when it comes to anytime you hear urban renewal, you have to just ask, like, who's the renewal for? Always ask that question. Anytime there's change, who is the change? Who is the change for? What is the change and who is it for? Who does it benefit? When you ask that question, who does it benefit? Then it kind of makes you take a step back because things look good on paper. They always look good on paper than they do in practice. But the stories I post really, my point is to bring light to the fact that not everything that glitters is gold.
Yeah.
But there is power in knowledge. And even on my health equity journey, my public health journey, I feel so much more empowered today than I ever have because of the historical context as it pertains to, speaking to individuals, especially my Black community. I've spoken to all backgrounds, all community, leaders, members, and, I'm well versed in disease prevention. I'm well versed in health education and health literacy. I'm well versed in the epidemiology, biostatistics. But then when it comes to being able to take the historical context, that helps explain policy, that helps explain outcomes, and helps explain the present day. That's in itself a real big blessing. And I really hope to be able to take that with my platform and continue the journey as we share those stories.
As a healthcare professional, for those who were listening, who were in healthcare policy, caregiving, right? What's one thing we could do to help push this public health, health equity concept forward?
I would say, I'm going to give you, I know you asked for one thing, but I'm going to give you three.
Give me, yeah.
Okay. I think the first thing right off the bat is just being an advocate of change. Being an advocate of change means you are not afraid to speak up. You are not afraid to speak out. You are not afraid to let your voice be heard. You're not afraid to let your purpose be known. That's the first thing, because a lot of us, we kind of talked about it in the beginning, where people have platforms larger than us, larger than life, but they're not speaking out as often as they could be. And when issues do come up, it's funny because the Grammys happened recently. People were asked questions. I won't get into it right now, but they were asked questions that were either politically affiliated, equity affiliated, and people with these big platforms, they were just like, hey, this is not a question for me. Hey, I'm not going to be able to answer that question. And so just being able to be an advocate of change. The second thing is knowing your ecosystem. Knowing your ecosystem. And when I say knowing your ecosystem, I really mean so much more in the sense of knowing who is around you, who is in the community you're serving, who can benefit from your information, who can be what's the population that you can reach out to. Because oftentimes, we have these lofty ideas about healthcare and advancing health, but sometimes we're not necessarily reaching the people who are local to us. We're trying to reach the people 2 states over when we have someone in our own state that we can reach out to. I think the third thing after awareness, and then making sure you know your local environment, connecting with peers, like I'm talking to you, you're talking to me, because when you connect with peers, you can exchange ideas, you can exchange concepts, you can exchange different train of thoughts. And I think that, even today's conversation, one of the things I like a lot, that you brought up the whole aspect of classism as it relates to health insurance and navigating it, right? I love that you brought it up, because this is not something that I'm always attacking at the same angle in which you attacked it at, right? Sure. Bring it into conceptual momentum. So I think those are the 3 things: awareness, being aware of who's in your local region, and then make sure you're continuously exchanging ideas, because that's how I get empowered. I get empowered just like this. I go back. Now I know what I'm going to talk about for the next 3 videos. I got some content from this conversation with these ideas. So,
well, for me, again, this was a pleasure, right? Next level. I genuinely believe and hope that we could do it again, because I have 30 more questions for you that I want to get to next time. But honestly, it's again, and I want to say this, I really do owe the beginning of my social media journey to you. And I'm telling you, it's just even seeing you in that chair now, and that video that popped up with the guy with the glasses, and he's giving us background and history on African Americans in this country. It's a full circle moment for me. So for one, definitely thank you for coming, but definitely also thank you for encouraging those. Because if you encourage me, I can think of obviously millions of other people that are watching you that are saying, God, I feel like I can get my purpose out there too. So for me and for all of the other ones, I know I'm gonna speak for other people, but I'm gonna speak for everybody today. I want to thank you for that, for putting yourself out there, for giving us knowledge and information that only honestly you are willing to give us, if we're being honest. But it's a pleasure. It's completely a blessing. And I want to set this up for a part 2. And if there's anything we could do for you, man, you got to let me know. But again, this is Dr. Michael Forde. Dr. Forde, thanks, man. I appreciate it.
Thank you. This was fun. It was definitely a great time.
All right, man. Thanks. Thank you.